Hello, welcome to Sdanmtc Alumni Health Promo. My name is Gideon. Our discussion is about glaucoma. Glaucoma. Again, I'm repeating glaucoma. Please drop your question and comments in the chat if any. This disease called glaucoma is a group of eye conditions that damage the optic nerve, which is the second cranial nerve. Glaucoma, when you forget the name, just remember coma. If you remember coma, you can remember glaucoma, because it is important for us to educate more people about this blinding eye condition. Which organs does glaucoma affect? The eye is the target of glaucoma, which are your organs of sight in front of your head. Everyone has two eyes, right? So one or both eyes can be affected. The optic nerve sends visual information from your eye to your brain, so that whatever your eye sees, the brain will interpret for you to know what it is. So damage to the optic nerve is often related to high pressure in your eye. But glaucoma can happen even with normal eye pressure. What is the cause of glaucoma? It is idiopathic. That means that we don't know the actual cause, but risk factors are real. The following are some of the risk factors. Glaucoma can damage vision before you notice any symptoms. So it is important to be aware of these risk factors. The first one is high internal eye pressure, also known as intraocular pressure, which is higher than normal, usually from age 40. Normal eye pressure is from about 10 to 20. So if you get higher intraocular pressures, it's a risk. And this usually occurs amongst the elderly from age 40. The next is Black, Asian, or Hispanic heritage. If you are a Black person, you are more at risk. If you are Asian, if you are Hispanic, because of our genetic makeup. Certain medications, medical conditions such as diabetes, migraines, high blood pressure, and sickle cell anemia makes our risk high. Corneas that are thin in the center, that one can be determined by the eye care professional. Extreme nearsightedness. So people with high myopia, so it's people with relatively larger eyes are termed very beautiful people, right? But people who have larger or bigger eyes are mostly myopic. That is, it is very difficult for them to see from far. They can see from near things, but things that are far away from them, they need glasses to see. Such people who have high myopia are usually at risk than people with relatively smaller eyes or medium-sized eyes. What are the symptoms that a patient can see if the person has glaucoma? The symptoms of glaucoma depend on the type and stage of your condition. There are many types of glaucoma, but most common one that we are talking about now is the open angle glaucoma, which affects most people. For that one, most patients see no symptoms in early stages, except blurred vision in late stages. So I remember in Ghana in 2013, the Komfuanochi Eye Clinic coined a name for open angle glaucoma. And they said in Chi, glaucoma is called Hunta Furaye. Hunta Furaye. Meaning glaucoma hides, and without hospital check, it blinds the one who has it. However, eye professionals can see signs if you visit the eye clinic, such as enlargement of the CDR, cap to disc ratio, nasalization of vessels of the optic disc, vessels. So in the optic disc, when you use ophthalmoscope to go into the eye, if the vessels that supply the optic disc are more towards the nose area, it's one of the signs. And then, of course, increased intraocular pressure. So these are the signs that are usually seen by the healthcare professional. Treatment. There are medications to help slow down blindness from glaucoma. The earlier treated, the better. However, medications must be taken for life. It's a chronic condition. So just like hypertension, diabetes, you will not stop taking your medications. Let's talk about the most important thing about this presentation: prevention of glaucoma. These steps may help detect and manage glaucoma in its early stages. That may help to prevent vision loss or slow its progress. First, get regular eye exams. Okay, don't say that I have no issues with my eye. At least, if you can check your eye once a year, that's fine. Or even once in 2 or 3 years, that's fine. But if you are at risk, then once every year is fine. Regular comprehensive eye exams can help detect glaucoma in its early stages before significant damage occurs. If you are at risk of glaucoma, you need at least once a year eye screening. Also, know your family's eye health history. If your mom says that doctor says I should put eye medication in my eyes, find out about that medication. Okay, if the eye medication is timolol, if the eye medication, you find the name to be for treatment of glaucoma, then you will have to follow suit and then check your eyes. Glaucoma tends to run in families. If you are at increased risk, you may need more frequent screening, such as once a year screening. So friends, this is about glaucoma. It affects many people before they know it. So we will encourage you to seek for treatment if you have it before it blinds you. And then if you don't have it, seek for screening to know your status. Sdanmtca Health Promo ends here. Thank you and God bless.